and must be verified by your doctor. If you need medical advice, please consult a doctor.
Hello, Assalamu alaikum, and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host, Fahad Matin, for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far, and looking forward for a nice and positive week. And this program is broadcasting from the studios of Inspire FM today on 20. On 4th of February 2020, and casting its positive vibes to all our lovely people in Luton and surrounding areas of Luton, like Dunstable, Harpenden, Bedford, and definitely our airwaves going all across from our social media, where you can view us or listen to us. So, if you are listening us via Inspire FM Facebook page or YouTube link, you can view us as well, and you can communicate with us, or you can listen us by Inspire FM mobile app as well as website. So we have many options. So definitely there is no no excuse for you guys not to get interact with us. But anyhow, if you do want to get interacted with us, you can always send your questions via text message on WhatsApp on 0777948182. Now, as we all know, we cover different health related topic every single week, and today's topic is very unique in a sense that it is a common topic which has been spoken pretty much anywhere and everywhere. You will hear about this on every single place, wherever you are, however you are, whatever you do. That is something which you hear, and that is two major things, which is COVID vaccine, and who are safe in COVID vaccine. Yes, indeed. One of the biggest problems which nowadays we do see is that whether you are safe from COVID, we know that during this second, or shall we say third lockdown, or the second peak, we have seen more COVID cases and COVID related deaths than ever in the whole COVID pandemic. It has gone. There are days when I heard that the deaths rate is very high, and yes, it is very high. So it is very confusing in sometimes that what we can do, and then all of a sudden we realize, yes, the COVID vaccines are out. Yes, we can do whatever we can do, and we can literally jump in and get our vaccine and bring our life back together. And wow, the light and the end of the tunnel, which we hear most of the evenings. But is it true? So there are people who have conspiracy theory about COVID vaccine. So let's deal with that. In order to do that, I have two lovely guests to do the first half of the show. Well, by the way, I'm covering two different half of the shows today. So first half we will be purely focusing on COVID vaccine, and definitely question answers about myths, and general question answers which we all have in our mind. And definitely when we come back from our break, we will talk about COVID effects in our children. Definitely we are hearing this news time and time again, and schools have been closed because of that. So definitely we will be talking on both subject matters accordingly. So first topic, let's jump into our first topic without further ado, and the topic for the first half is COVID vaccine question and answers as well as myth busting. Now, as always, I'm not the only one who will be talking about this topic by myself. I have been joined by two lovely guests. I'm still waiting for my second guest. My first guest has already arrived, and with me in the virtual studio, or shall I say, virtual platform of Inspire FM, and she is one of the GPs and local and CCG's respiratory lead, and most of us know her as well. I've known her, and I always call her Dayo because she's a very lovely friend of mine, a very lovely colleague, which I always respect and look towards. And definitely, but I'm not the one who will be introducing her. She will be introducing herself. So, can I ask you Dayo KuKu, Dr. Dayo KuKu, welcome to Inspire FM. How are you today?
Thank you, Fahad. I'd like to say a big thank you for inviting me on your platform. I'd also like to say a big thank you to everyone who has tuned in. We do appreciate your time. My name is Dr. Dayo KuKu, just as Fahad has said. I'm popularly known on social media as Dr. K. I'm the respiratory clinical lead for the CCG, and I work at Flitic Surgery as a local GP in Bedfordshire.
Yes, indeed. And definitely, we know Dr. Kuku from many different angles, but she's commonly known as the doctor who answer and give all the answers regarding COVID vaccine. Isn't it true, doctor?
Yes, it is. It's a passion for now.
And definitely, when we talk about COVID vaccine, it is a massive topic. It is a massive topic. People have so many myths, so many things going on in the background. We just like to know what is happening. There are even myths saying that there are people being chip trace or even make people infertile or something. But we will answer all those things in due course of time. But if you have any questions or queries regarding our topic tonight, please do get in touch with us by sending your text message on 07779481822. You can send your WhatsApp message as well on the same number, which is 07779481822. I repeat, 07779481822. Or if you are watching us through Facebook or YouTube, you can always send your questions by their platforms as well. But without further ado, let's go to our topic tonight. Let me ask you, Dale, please tell us, how can we get COVID vaccine?
Okay, yeah, that's a very relevant question. So the COVID vaccine actually is being given to different groups of people.
Hmm.
And this is actually decided by the Joint Committee of Vaccination and Immunization. So, how do you get the COVID vaccine? The first answer will be by invitation.
Hmm.
So, if you're eligible, you will get an invitation. But what you find is different groups are being given at different times, and we call them cohorts. So, first of all, it's given to people in care homes, residents in care homes, and older adults and their carers. Then the next group will be the over 80. Then it goes down to the 75-year-old. Also, most important is the fact that it's given to the healthcare professionals. So,
Hmm.
if you're a healthcare professional, you should be in the first cohort.
Hmm.
Also, if you are a carer or
Hmm.
someone that works in the health and social sector, you are eligible. If you are a pharmacist, if you are a key worker, you are eligible. And people say money with your name on it, but we're now saying vaccine with your name on it. We're waiting for you. We're waiting for you to be vaccinated. So please, get in touch with your employer if you don't know how to go about it, and they'll signpost you to where to get it. The people are waiting for you. There are volunteers out there, there are healthcare professionals out there. They're waiting for you to get it. And it's very important that you get it, because if you fall ill, that would not be good. Also, you are very vulnerable because you're on the front line. So it is important that you get it to protect yourself and also to protect the people you're looking after.
Indeed, indeed. And also joining me, Alhamdulillah, within no time, is Dr. Sanita Chakrabarti. So let me give a quick introduction about the. Let me ask Dr. Sanita to give a quick introduction about herself before jumping back into the topic. So, good evening, Sanita. How are you today?
Good evening. Yes. Assalamu alaikum to all the people listening in today. A very, very important topic of discussions today, and really glad to be here with my friend Dayo to do this show for you. I am a doctor. I'm a public health doctor, and I work in Bedfordshire and Milton Keynes and Luton, and really uh, um, really happy to be here today to answer some questions from colleagues.
Thanks, Dr. Sanita. Um, Now, one of the other things people do ask, and this is very commonly asked, especially when we heard that there's a new variant in UK, and then we all of a sudden we heard there's another variant from South Africa which we imported, and then there are other variants as well, and then because of that, we now cannot travel anywhere, even more than so. So, will this vaccine, the COVID vaccine, cover us from these new variant? And how can I book an appointment? And like, for example, myself, can I go online and book an appointment?
So yeah, that's a very relevant question. Thank you. The new variant, I'm pleased to let you know that the vaccines we have covers the new variants. Evidence shows that 99%, it covers 99%. So with everything, it's not 100%. It's just 1% that may not be covered. So that tells me that you're better off getting the vaccination rather than not, because the chance that it would cover you is higher than not. How do
Hmm.
you get the vaccination? Like I said, you will be invited. You will
Hmm.
be invited if you're due for the vaccination. If you don't know what to do, ring up your employer, ask them about it, and they'll signpost you to the right place.
Hmm. Sanita, do you want to add anything?
Yeah, so as I say, and just to add to Deo, so Deo is very, very clearly identified the people that are eligible for the vaccination now. So, so if you are somebody who is 80-year-old, above 75-year-old, if you are known to have to be shielding and classified as clinically extremely vulnerable, wait for your letter to come through, and once you've got that, then of course the letter will have information as to how you get your appointment. But if you're a health and social care person, if you're delivering care in any form, so if you're a pharmacist, dentist, physician, you should be eligible for your vaccine. So do contact the person, so your local area who is giving your vaccine, and find out, because health and social care workers are priority, and to protect our loved ones, as the topic is, and as Dale said, we need to protect ourselves first. So us doctors need to protect ourselves first, and then only we can protect the people that we look after. So as Dale said, there's a vaccine with your name on it. If you are invited, please go and get it.
Definitely, definitely, a vaccine just have your name on it, and if you have not took the vaccine yet, please do not delay. Take it today. Those are the messages which we want to know. But one of the other things people do now say is that, okay, and this is something who are in their 80s, and I have seen people, I have heard from different people that once those people are having their vaccines, they have a very awkward thing in their mind that, okay, I have a vaccine now. That means I don't need to wear a mask. I don't need to do social distancing. I can go out for party and live my life as before. Is that true?
So if you have received the vaccine, I will say congratulations, you've done the right thing. But most importantly is we all still have to follow guidelines. The reason being the vaccine will cover 95%. It is not 100%. There is
Hmm.
that small chance that you could still transmit the virus. So it is important that we do hands, wash your hands, face, put on your face mask, space, social distance. We cannot take it for granted that because you've had the vaccine, you are immune, you are covered, and you're not able to transmit the disease. So it is very important that we still follow the guidance. Also, we need to recognize that when we get the vaccine, it takes a week or more for your body to build the full immunity. And based on that, you cannot assume that you're immediately covered. So please remember, hands, face, space. Thank you.
Indeed. Face, hand faces space. Sunita, do you want to add something?
No, and I know everybody is. We are all struggling, aren't we? I know we are. Can't see our patients all the time. Can't do the things we always do, and we want to get out of this situation, don't we? But the only way out is if we protect our loved ones and we get the vaccine and get them the vaccine. So the more people that get the vaccine, we can reduce the virus in the community, and maybe that will help us get onto the lives that we want to get onto, like Fahad was saying, get onto our holidays and stuff. So please get the vaccine, but also remember, you can still be transmitting the virus. So absolutely, social distancing, wear your face mask, and wash your hands. We
Indeed, and
cannot compromise that.
indeed, and no partying. The partying time is not yet here. So the light on the tunnel is still far ahead. It says the light after on the other side of the tunnel, but it is very, very far ahead. Although it looks like it's ages since we have seen that light, but hey ho, it is what it is. But one of the other things people do ask, and this is in some countries, it says that the Oxford jab is not very effective in over 65 people. How true is that?
So the research has been done. Evidence shows that it was actually tested in people over 65. So
Hmm.
it is as effective in the age group over 65. It is important that if you're over 65, you get the vaccine.
Hmm.
One of the things that will happen is you don't have a choice over the vaccine. You will be offered the right vaccine. And when you're offered it, please take it. Evidence shows that it is effective in people over age 65.
Indeed. And in terms, Sunita, do you want to add something? And are any people? So what I want to ask you, Sunita, is that uh, is there any people who cannot get the vaccine? I mean, who are not allowed to have vaccine?
There's a very, very tiny group of people who maybe have got severe allergic reactions to a whole lot of things, and they're possibly, and I stress on the word possibly, not eligible. But again, this is something that they need to talk to their doctors about. So your GP will absolutely know what you're allergic to and what you're not allergic to. And a lot of us are allergic to strawberries and this, that, and the other. But it is important to talk to your GP, because the GP can then advise you correctly whether you are suitable for
Hmm.
the vaccines. But when we're looking at the thousands of vaccinations we've conducted so far, we've had so few people with any severe reactions to the vaccines. And therefore, I'm sure that the risk, the what we're getting from our GPs with their advice, with the patient's medical history, is definitely taking that into account. So we're vaccinating the right people, because very, very few people are coming up with any side effects. So just go back to your question. Very, very tiny group of people may not be able to take the vaccine, but the advice is, if in doubt, talk to your GP, because your GP will be the right person who will know exactly whether you are suitable or not.
Now, I do receive a couple of questions online, and let me try to put it on the screen as well. It will be much easier. What is the duration between two doses of vaccine?
So
Sorry,
we all
sorry, dear. You were, for some bizarre reason, just gone on mute. So can you repeat what you were just saying?
Yeah. So we all should have two doses of the vaccines, and for clarity's sake, in the UK, the guidance at the moment is that there should be 12 weeks between the first dose and the second dose. So you will be given a specific date for your second dose when you get your first dose, and based on that, you should attend for your second dose.
So what if somebody was not given the information regarding the second dose, and what will happen if like there are people who just have one appointment, and they like some of our health professionals as well, they just had the vaccine like in last 2 weeks, and they still do not know when can they have the second one, haven't got the appointment. What can then person do?
So if you got the first dose and you don't know when you're eligible for the second dose, most of the time you get your second dose from the same center. So you
Hmm.
can either contact the center and explain to them that you got your first dose, you don't know when your second dose is due, they'll let you know. If in doubt, always get in touch with your healthcare professional, get in touch with your GP, and your GP can advise you or signpost you in the right direction.
Sanita, anything to add?
No, I think it's important for us to just emphasize that you will get a second dose. So I think there's a lot of doubt, and people are thinking, well, 12 weeks is a long time. Are you sure you're going to call me back again? We promise we will. So
Hmm.
whoever has given you your first dose will call you back and give you your second dose. And the guidance, as Dale said, is 12 weeks.
Hmm.
Just for skeptics, sorry, for skeptics, I'd like to mention the fact that people say, oh, but I should get mine after 3 weeks. In the UK, the government has taken the right decision to vaccinate the majority of the people first with the first dose before we go on to the second dose. So don't you worry if you're thinking, well, the manufacturer said three weeks. They have done further research on that, and it has shown that you're immune and covered until you have your second dose.
Indeed. Now, this is a second question which been asked on Facebook, and it says, "My husband is taking methotrexate for his medical condition. So, will it interact with the vaccine?"
Thank you. That's a very, very relevant question. And a lot of people are worried about taking medications that could suppress their immune system. Methotrexate, if you're taking methotrexate or any immunosuppressants, you should still have your vaccine. Research has been done and evidence shows that you are safe taking the vaccine. So please go ahead and take it. If you are in any doubt, discuss it with your GP and your GP will clarify better.
Hmm. And in terms of the one of the things which also people do ask, and have been asking me, because you guys know I also work in the health sector. They says that Pfizer is better than AstraZeneca, and they sometimes emphasize that they should have Pfizer rather than AstraZeneca, and vice versa. How true is that, Sanita?
Um, okay.
No, I'll let Dale go first. She started it
Yeah.
already.
Yeah. So there are two different vaccines in the UK. In other countries, they have more than two. So the difference between the two is just the carrier. The
Hmm.
way in which they were made, they are as effective as each other. One is the mRNA, which is the spike protein, and the other it contains the adenovirus vector. But both of them are are effective. It doesn't matter which one you take. The important thing is that both of them will boost your immune system and help you fight the coronavirus, which causes COVID-19.
Hmm. And one of the things people do ask is, Pfizer is 95% efficient and AstraZeneca is 90% efficient. What does it mean? That means it will only affect 95% people and miss 5% people, or it will affect you 95% altogether?
So, thank you. So, like I said, for every medication or anything you take, it's you hardly will get 100% cover. What that means is 95 out of 100 people vaccinated will be covered against the coronavirus. Yeah, and if you think about it, 95% is a large number. So, we want to encourage you to please go ahead and take the vaccination. And 95%, 90%, that's a large number. So it is very effective. And please, please go ahead and take the vaccination.
Hmm. Indeed, indeed. And as we are approach, wow, the time has passed really, really, really quickly. We just literally have like 2 minutes remaining. So can we both have positive message before we end of this particular topic? And when we come back from the show, we will have another topic. So let's start with you, Dale. What is your positive message?
So my positive message is these are unprecedented times. We all have had difficult times. For every one of us, we are aware of someone who's been affected by the COVID-19 disease. It could be your loved ones, it could be your children, it could be friends. We need to get out of this pandemic, and the vaccination is one of the most effective ways to stop us from this pandemic. I want to encourage us that even though there are lots of myths out there are things like, oh, you'll be made a zombie if you take it. That's not true. There are things like, oh, there are microchips in there, and if you get it, then they're going to be monitoring you. Oh, no, they can monitor through your phone or through your bank cards rather than through the vaccination. There are things like, oh, I'm worried there's animal protein in there. No, there are no animal products in the vaccine. The vaccine is one of the best things that has been produced to get us out of this pandemic. So please, 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 if you are eligible, once you are invited, go ahead and get your vaccination. I have got my own first dose of vaccination, and I am still smiling. I'm not backing, and I'm not a zombie yet. Thank you.
And definitely, when we come back from the break, we have another topic joining us, and that will be around the topic of effects of COVID effects in children's. That will be about COVID effects in children's, and definitely when we come back from the break, we will talk a bit more about that particular issue. But on this issue, I will say thank you so much, Dayo, for joining us, and definitely, so Dr. Sanita Chakrabarti will be with us on the second half. So when we come back, so thank you so much, Dayo, for joining us on the first half.
Thank you.
And
So-
we just to say that I think there was a question around, can
On
you take the
breastfeeding.
vaccine if you're breastfeeding? I think the answer is yes, you can. If you're a healthcare professional and you're still breastfeeding and you think you are exposed and you want to cover yourself, talk to your provider, and I'm sure you can get the vaccine.
So we will be back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Assalamu alaikum, my name is Tafael. I'm the director of MFest. Please keep listening to Inspire FM at 105.1 FM.
अगर आप वजन घटाना चाहते हैं तो सब कुछ सही करना नहीं, शुरुआत करना जरूरी है। सेहतमंद बदलाव छोटे छोटे बदलावों से शुरू होते हैं और आपको भीतर और बाहर से बेहतर महसूस करने में मदद करते हैं, ताकि आप अधिक स्वस्थ बने और बीमारियों से अधिक मजबूती से लड़ सके। वजन घटाने में आपकी मदद करने के लिए NHS के पास बहुत सारे सुझाव हैं। खोजिए बेटर हेल्थ। आइए ऐसा करें।
Biscard Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscard Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our Stop Smoking service. We're open 7 days a week till late, including bank holidays. Biscard Pharmacy, 157A Biscard Road, Luton, or 457709.
Why do Tops Pizza deliver the top pizzas in Luton? For a start, all the toppings are 100% halal and Tops use fresh dough every day. Then there's the cheese, the highest quality available. And when it comes to food preparation, cleanliness is taken as part of our faith. So that just leaves the taste, choice, and great offers, including buy one, get one free on all medium, large, and extra large pizzas. Tops Pizzas, Wellington Street, LU1 5AA. Order online, topspizza.com or via Just Eat. Download our app or call 01582 72 5000.
Applications are now open for our September 21 reception class at King's House Independent School in Luton. It's where our dedicated and caring staff nurture young children in small classes, helping them to get the best start in life. And with our King's House School Early Learning Programme, we teach reading, writing and numeracy through a fun and enjoyable curriculum, whilst developing self-confidence and other talents too. If you'd like to apply for a place for your child, call Luton 491430 or click on kingshouseschool.co.uk.
Could you look a shop assistant in the eyes and tell them your trip is essential? Can you honestly tell the cashier you keep a safe distance from other shoppers? Hand on heart, do you always wear your face covering over your mouth and nose? The more often you leave home, the more likely you are to come into contact with COVID-19. Try to shop less often, and if possible on your own. Stay home. Protect the NHS. Save lives.
खून जमा देने वाली सर्दी, शदीद बर्फबारी और तूफानी बारिशों के बाद सैलाब की सूरत हाल। मुल्क शाम की सर्दियां जानलेवा हैं। शाम के जरूरतमंदों को खुराक, गर्म कपड़े और कंबल पहुंचाने में SKT की मदद कीजिए। आपके सिर्फ 20 पाउंड बेआसरा खानदानों के लिए बड़ा आसरा बन सकते हैं। कोरोना की मौलिक वबा और सर्द मौसम में अपने भाइयों को मुश्किलात से निकालने के लिए SKT वेलफेयर की मदद करें। विजिट करें skTwelfare.org या 0300 302 0786 पर कॉल करें।
Do not treat any good deed lightly. It is part of good manners to receive your brother or friend warmly. The same holds true for doing them a favor, no matter how small it might be.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Hello and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy. This is the second half of the Health and Fitness Show, and we started with a bang in many different ways, because when we started our show, we started on our show with a topic which is very unique in a sense that it was about COVID vaccine question and answers as well as myths. Now, unfortunately, with the due course of time and the shortage of time, we did not manage to answer and ask all the questions which we have in our mind, and there are more questions pouring up left, right, and center, and apparently they are we just wanted to ask them, but then apparently with the due course of time and the shortage of time, we did not manage to ask all of them. However, this is the second part of the show, and when in this part of the show we will be talking about the COVID effects in children, and definitely it is another very important topic, in a way that children's nowadays being let go from their schools, and we definitely want them back in our schools, and we want them to take part in our schools every single day, and definitely we want kids to have full life. But with COVID, as always, not just affecting adults, it's affecting kids as well. Now, before we went on break, we were talking about COVID vaccine, and then just when we were about to go on break, there was a question popped up, and Sanita so kindly tried to answer that. So I will ask Sanita to answer that after I will introduce our listeners. So our second half of the show is, as I said, about effect of COVID-19 in children, and in this half of the show, I'm joined by again two lovely guests. First one is Dr. Sanita Chakrabarti, and second one is Dr. Anne Ingram and Dr. Anne Ingram is the PED consultant from Luton and Dunstable Hospital. For some bizarre reason, her connection is dropping again and again. So hence I'll go back to Dr. Sanita Chakrabarti and ask her regarding the question which was asked just before we went on break. And that question was, great show. Thank you so much that you guys have liked the show so far. Can breastfeeding women take the vaccine? Sanita?
So the answer is yes. But if you're a health and care worker and you're breastfeeding, then of course you can get the vaccine. That's not a problem at all. There is no data to say that it is harmful in any possible way. So absolutely, you can take the vaccine. So I would encourage women to take the vaccine. And I think when we stopped at the show, it was pretty crucial. I'm sure, as Fahad said, we've now known many of our loved and dear ones, and we know of our patients who are suffering quite a lot if they've had COVID. Now, if we can not get the COVID, and we can protect ourselves with a small injection, which is a vaccine, I would take that because having COVID is really, really makes you very poorly. And it's not as if that you suffer like sort of then and there. Of course you do, but COVID lives and the vaccine lives, it lives a lot of side effects. And we are now seeing all of our patients who've got COVID with long-standing issues, which we know that we might have to treat for many, 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 many months at least, if not years. So the best thing that we can get, and it's a gift to us, that it's not a choice, it's a health protection issue. To protect ourselves, the vaccine is very important. I'll stop there, Fahad, because I see Anne is now here, a good friend of mine again.
So on this note, I will definitely ask Dr. Anne Ingram to introduce herself and give a quick introduction about herself. So over to you, Dr. Anne.
Hi, I'm so sorry. My trusty iPad let me down and I was having some crackly issues. Thank you so much for inviting me to this program. My name's Dr. Anne Ingram at Luton Dunstable Hospital.
And unfortunately, IT is one of those things which let us down time and time again. But hey ho, we are at the age where we have no other choice but to rely on IT and whatever IT we have. So jumping on the second part of the show, which is COVID effects in children. Now, I want to start the show by asking Dr. Anne Ingram is please tell us about how COVID affect our children's health.
Sure. So COVID affects our children in many different ways. There's obviously the direct effect of a child contracting, but we know that this is a very small percent of positive cases were found in children. I think that children's well-being, obviously with the closure of schools back in March last year, and also since Christmas, there's a huge loss of education, and I say that with great respect to what teachers and schools are doing for children homeschooling, but it's not the same as children being in the classroom, and I fear that it just widens the learning gap between those who have and those who don't have, and there are many families that will struggle to homeschool one or more children. I think, as well as the impact on education, school is a huge social outlet for children. And with the closure of schools, with the withdrawal of clubs, activities, sports, it has a significant impact on children's mental health. And we know this. There have been there's been an increase in anxiety and depression in general. There's been a huge increase in referrals to child and adolescent mental health services. And we in the hospital have seen an increase in admissions to the ward with mental health problems. And then finally, the final effect is on those possible undisclosed underlying conditions that are being diagnosed later than they would be, because for one reason or another, families feel anxious about taking their children to hospital or to general practice. Sometimes it's harder to express things over a virtual appointment. And so there's the worry that we'll pick up conditions later than we would do normally.
Mm-hmm. Indeed. For listeners, if you have any questions or queries regarding our topic tonight, which is second topic tonight, which is COVID effect in children, please get in touch with us by sending your text message and WhatsApp on 07779481822. I repeat, 07779481822. Or you can send your questions via WhatsApp as well, or by Facebook Messenger as well. And wow, as soon as I said, I just got a message. Wow. So, what are the common symptoms in children? I think so. What the listener is referring towards is the common symptoms of COVID in children. Doc?
Do you want me to answer that one?
Yes,
Yep.
please.
So there are the symptoms of COVID are quite widespread. So they are symptoms of a common cold. So, you know, some children with COVID may have a bit of a runny nose, a sore throat, a cough. I think about a third of children are asymptomatic, so you won't see any symptoms. And then there are the more the symptoms more associated with the sort of post-COVID syndrome, or what we call PIMS-TS, which can be more of a prolonged fever, sometimes rash, conjunctivitis, abdominal pain, diarrhea and vomiting. So it's really a wide spectrum of symptoms. It's not just sort of limited to the three that that have been highlighted throughout. So high fever, persistent cough, and loss of sense of taste or smell. There are a wide range of that could be COVID, but also could be not COVID, could be another virus.
Mm-hmm. I have few other questions popped on my screen. I'm trying to put it on the screen.
Yeah, while you're doing that, I think it'll be good to emphasize, Anne, that our practices and our hospitals are all open. So I know it's locked down, and it feels like we not should be going anywhere. If we have any concerns about any symptoms with our children, our GPs are there, our hospitals are open. Please access them. It's important we see the children sooner rather than later. So if you've got any concerns, and I'm hoping that you want to say that because you're at the L&D, and I'm more than sure that our GP services will say the same as well.
One of the other questions which I received by text message, it says, Islam, if children are not being offered vaccine, can you please explain how breastfeeding mothers can take the vaccine also? And said, and also you said that the monitoring of phones and bank card, why it's very creepy. Sorry. I've just literally lost my feed of questions in front of me. I'm not sure why. It happens. So yes, here you go. Yeah. So why would they need to do that unless they are dealing with the criminal crime suspicion? So I think so. What person is trying to ask is why, if children are not being offered a vaccine, then please explain how breastfeeding mothers can take vaccine.
So
Sanita?
we are learning all the time with these vaccines, and we don't have any trials at the minute. We don't have any studies to say that about the effect of the vaccine on children. So at the minute, the current guidance is the vaccine is only suitable for people who are age 16 and above, for the Pfizer, and 18 and above if you're taking the AstraZeneca. So it is more in that adult. So there is no vaccine available for children, unfortunately. The evidence around can you take the vaccine when you're breastfeeding? Again, the data is very limited, but if you're at risk of getting COVID and you're breastfeeding, on balance, if you get the vaccine, you protect yourself and you protect everybody around you as well. And if you're a health and care worker, the chances of you being exposed to people who've got COVID is more. So if you're a health and care worker and you're breastfeeding, it'll be important to get the vaccine, because it's okay. It hasn't, in all of the several vaccinations that are already out there, we've not seen any impact, but we've not kind of seen any difficulties with that as well. But we're learning all the time. But definitely, for sure, we don't have any vaccine at the minute for children. Anne, did you want to come in on that?
Yeah, I mean, I agree with you said, Sanita. I think the only addition was recently the regulating body have said that in certain circumstances where a clinician decides necessary, it can be given to children below the age of 16. But those are only in very, very specific and small cases that would be considered on a case-by-case basis.
Okay, I'm sorry, I'm a bit kind of confused, as in my screen is pouring with questions at the moment. One of the other questions was asked is how much can the virus affect kids, and once children recover from the virus, will they affect them again with the virus, and are the symptoms are same in kids as well as adults?
Okay, so there are a few questions there, and unfortunately, because we've seen much smaller, though a number of those questions we don't know the answer to. I think there's a lot been spoken about long COVID in adults, and adults tend to present with these very significant problems that then to other sort of difficulties. I don't see that of the children that we do see. That is a very, very small portion. The numbers with significant breathing problems are also very small. So we don't know whether there will be long COVID in children. There is some evidence that those children who suffer with what we call PIMS-TS, the post-inflammatory syndrome, that there are some sequelae in the sort of medium term following that. And I think those can be a variety of symptoms such as fatigue, muscle weakness, some sort of cognitive issues, anxiety, but data is being collected all the time, and hopefully we will know more.
Mm-hmm. Sorry, another question popped on the screen. Which age group kids are more affected?
So I think I don't have the numbers to hand in front of me. However, from what I've seen in our local hospital, is it will tend to be the older children, so the secondary school age children, and sometimes the under ones. And I know that studies have shown that sometimes the under ones may have a slightly increased risk of severe disease, as do the older children.
Another one just popped on my screen, and it's similar to the one which I was about to ask, is that can children wear mask if to safeguard themselves from COVID-19? Sanita?
I think there is an age restriction as to when the masks are, isn't it? And maybe Anne would want to take that question. Yeah.
Anne?
So I think the advice is children under 3 shouldn't wear a mask. But over 3s, there's no reason why they shouldn't. But I think in very little children, it depends on how they feel about it. I think it would be better to have a child happy outside without a mask on than one screaming and crying, therefore exposing more droplets because they don't want one on. But there's no reason. I mean, masks, they're becoming the norm for us all, and yes, it's not pleasant having them on for hours and hours of the day, but hopefully at the moment children aren't going out for significant periods of time, so I don't think it would hurt for the time that they are out them to wear a mask.
And one of the questions, sorry.
Just Anne, but there are certain children out there, and particularly if they've got a disability or if they've got some learning difficulty and they're struggling to understand the mask, then they can be exempted. Yeah. So
yes, indeed, yeah.
And another question popped on the screen says, just want to be clear, I know I'll be safe from getting COVID after vaccines, but does having the vaccine means I won't ever pass it to anyone? I think so. It's for you, Sunita.
You will be protected, but it doesn't mean that you're not going to be able to pass the vaccine to pass the virus to anybody else. There is
Including
no,
kids.
including kids. So it is, as we talked about in the first half of the program, it's still important to be doing the social isolating, wearing the mask, and keeping all those washing your hands, washing and keeping surfaces clean that we've been doing for the last year or more now, to make sure that we are not transmitting it to our loved ones as well. So yes, you can get the vaccine, which will protect you, but it doesn't prevent you from spreading the virus. You are still prone to spread the virus, and so therefore we have to do hands, face, space.
Again, one of the things many people have asked, and I absolutely, being a parent myself, love to ask, is that if my child is ill due to cold, cough, or even flu, how do I know that it is not because of it is not due to uh, how do I know that this illness is not due to a common viral illness, or my child end up affected with the COVID-19? How do I know? Because one of the biggest worry when the school was open was that same thing, that if a child come with slightly poor symptoms of viral illness, which is very common, it's nothing to do with COVID-19.
I'm afraid the short answer to that is you don't know unless you get them tested. And I think testing is very available now. Certainly, if your child fits any of those three criteria, so high temperature, persistent when you cough, continuous cough, a lot of, then you should be arranging a test, and either I think you can do that via phone booking one. But I think for any symptom that you're not sure about, I think it's entirely reasonable, and actually probably the safest thing to do at the moment is to get a test, to self-isolate until you have that, because the only way we are going to come out of this is by containing the virus. And at the moment, although numbers are coming down, they're not perhaps coming down as rapidly as we would have hoped, and we've already a month. The only way we will come out of lockdown is if those numbers significantly come down.
I think so. For some bizarre reason, Dr. Anne Ingram
Yourself and
has
your
dropped
family
out.
safe.
Oh, hello, Dr. Anne. Sorry,
Hello,
you were dropped
sorry,
out.
did I drop out?
Yeah.
Yes. So get a test, self-isolate until you know, and then you have the answer, and we can manage it safely.
But if in doubt, is the advice call 111?
Yes, you can do. Yes, call 111. Yes, but I think for a common cold where you're a bit sniffy, runny nose or throat.
Think so. I lost Dr. Anne again. Wow, the time has passed really, really quickly, and it's just under 3 minutes remaining before the end of the show. So, can I ask both of you to put a quick positive message before we end of our show? Dr. Anne, are you back?
Yeah, sorry. So I think what I would say is that we know children are at a much lesser risk of acute COVID than adults, but the impact of lockdown is very significant on their well-being, and we all need to do what we can to move forward and get out of this state that we're in. And the only way we can do that is by reducing the case numbers and increasing those who are vaccinated. So government guidance has an impact on the whole country, the whole world, in fact. Hands, face, space, and if you're offered the vaccine, grab it with both hands, or at least put your arm out.
Indeed, indeed. And Dr. Sanita Chakrabarti.
And I think my message is exactly the same. The vaccines are safe. They don't cause any infertility in women or men. There is no evidence to say any of that. If you want any more information, we've got a really helpful website that Fahad can share. It's on our Bedfordshire, Luton, Milton Keynes CCG website. There is a lot of government websites. Please go to those to get the authentic information. If your loved one, elderly parents, grandparents have been offered the vaccine and you're still considering and thinking whether they should or not, is it safe or not, we've vaccinated several thousands of over 80-year-olds, over 70-year-olds now with very, very little side effect. If you've been offered the vaccine and your loved ones have been offered the vaccine, please go ahead and take it. That's the only way we can go back into our normal lives. We can send our children back to school. We can go back into shopping, holidays, and our religious places as well. So the only way out is if we can take our vaccine.
Indeed. And on that note, I must say thank you very much to both of you for joining our show and sharing such a valuable knowledge and information. So thank you so much, Dr. Anne Ingram, and thank you so much, Dr. Sanita Chakrabarti, for joining our show tonight.
Thank you.
Thanks, Fahad. Thanks for having us.
Thank you. And that's all for tonight, guys. So if you have missed any part of the show, you can always watch the whole thing in rerun on our online platform, which is Inspire FM Facebook page as well as YouTube channels. But all we like to do is stay safe. Keep yourself in the same distance, which is safe hand face space, and definitely look out for yourself, look out for your kids, look out for your elderlies, and if you get a chance to get vaccine as soon as you can. Until next week, I'm your host Fahad Matting saying assalamu alaikum.
Assalamu alaikum.
Assalamu alaikum. In Luton,